Continuing with Chapter 5, Objective 3, now we're going to define, pronounce, and spell disease and disorder terms related to the respiratory system. So let's start with the terms built from word parts, so they can have a prefix, suffix, word root, or a combination of everything. So, adenoiditis, inflammation of the adenoids. Alveolitis, inflammation of the alveoli. Atelectasis, incomplete expansion. Bronchiectasis, dilation of the bronchi. Bronchitis, inflammation of the bronchi. Bronchogenic carcinoma, cancerous tumor originating in the bronchus. Bronchopneumonia, disease state of the bronchi and lungs. Diaphragmatocele, hernia of the diaphragm. Epiglottis, inflammation of the epiglottis. Epiglottitis, inflammation of the epiglottis. Hemothorax, blood in the chest cavity. Laryngitis, inflammation of the larynx. Laryngotracheobronchitis, inflammation of the larynx, trachea, and bronchi, also called croup. Lobar pneumonia, pertaining to the lobes. Nasopharyngitis, inflammation of the nose and pharynx. Pharyngitis, inflammation of the pharynx. Pleuritis, inflammation of the pleura, also called pleurisy. Pneumatocele, hernia of the lung. Pneumoconiosis, abnormal condition of dust in the lungs. Pneumonia, disease state of the lung. Pneumonitis, inflammation of the lung. Pneumothorax, air in the chest cavity. Pulmonary neoplasm, pertaining to in the lung, new growth. Pyothorax, pus in the chest cavity. Rhinitis, inflammation of the nose. Rhinomycosis, abnormal condition of fungus in the nose. Rhinorrhagia, rapid flow of blood from the nose, so basically it's a nosebleed, or it's also called epistaxis. Sinusitis, inflammation of the sinuses. Thoracalgia, pain in the chest. Tonsillitis, inflammation of the tonsils. Tracheitis, inflammation of the trachea. And tracheostenosis, narrowing of the trachea. Again, lots of exercises in your book for extra practice. So now they're just grouping a few combining forms together to form other words. Again, we have the combining form pharyngo, so we can create the medical term nasopharyngitis or pharyngitis. We have the combining form laryngo. Again, you can create laryngitis or laryngotracheobronchitis. And then you have pneumo or pneumono, so you have pneumonia or pneumothorax. So here they're giving us the definition and we're creating the medical term. So what combining form could mean air? So again, just go back to the beginning. And hopefully there's actually three options. Pneumo, pneumato, and pneumono could all mean air. And then of course your combining vowel would be the O. And then chest cavity. So which suffix means chest cavity, and so hopefully you chose thorax for this one. And so which of the words that we just learned that meant air in the chest cavity, and hopefully you are choosing pneumothorax. Whoops, they both came up at the same time, I apologize. So the other one is blood in the chest cavity, so hemo is blood, so hemothorax is the other one. And then atelectasis is incomplete expansion, and so here they're just breaking it up into word parts below. And a diagnosis similar to atelectasis is bronchi and then dilation. So if you find the combining form that means bronchi and then the suffix that means dilation, you will come up with bronchiectasis as your term. And now let's go over the disease and disorders not built from word parts. So again, they're just a little bit harder to memorize because you cannot break them up into word parts. So first we have acute respiratory distress syndrome, or ARDS, respiratory failure as a result of disease or injury. Asthma, respiratory distress characterized by coughing, wheezing, and shortness of breath caused by constriction and inflammation of airways that is reversible between attacks. Chronic obstructive pulmonary disease, or COPD, progressive lung disease obstructing airflow, which makes breathing difficult. I'm going to look at the pronunciation guide for this one. Coccidioidomycosis, a fungal disease affecting the lungs and sometimes other organs of the body, also called valley fever. Then we have croup, condition resulting from acute obstruction of the larynx characterized by a barking cough. Cystic fibrosis, or CF, hereditary disorder of the exocrine glands characterized by excessive mucus production in the respiratory tract, pancreatic deficiency, and other symptoms. A deviated septum, one part of the nasal cavity is smaller because of malformation or injury of the nasal septum. Epistaxis, a nosebleed, also called rhinorrhea. Idiopathic pulmonary fibrosis, chronic progressive lung disorder characterized by increasing scarring which ultimately reduces the capacity of the lungs. Influenza or flu, highly contagious and often severe viral infection of the respiratory tract. Obstructive sleep apnea, repetitive pharyngeal collapse during sleep which leads to transient periods of apnea or absence of breathing. Pertussis, highly contagious bacterial infection of the respiratory tract. Pleural effusion, fluid in the pleural space caused by disease, process, or trauma. Pulmonary edema, fluid accumulation in the alveoli and bronchioles, most often a manifestation of heart failure. Pulmonary embolism, matter foreign to the circulation carried to the pulmonary artery and its branches where it blocks circulation to the lungs and can be fatal if sufficient size or number. Pulmonary emphysema, loss of elasticity of the alveoli resulting in distension causing stretching of the lung. Tuberculosis, infectious bacterial disease most commonly spread by inhalation of small particles and usually affecting the lungs. And then we have upper respiratory infection of the nasal cavity, pharynx, or larynx, usually caused by a virus. This is basically the common cold. So here we just have a picture of pulmonary emphysema and bronchitis. Here's a picture of obstructive sleep apnea. Here are just some diagnostic, surgical, and therapeutic procedures. So here's a review question. Pulmonary emphysema and bronchitis are components of what disease? Is it COPD, TB, or OSA? So hopefully you chose A, COPD, which is again a progressive lung disease obstructing airflow, which makes breathing difficult. It's also commonly caused by cigarette smoking. And that should be it for this recording.